So as we spoke about PCOD, one of the complications of PCOD is infertility.
Yes.
So what is your experience in treating infertility cases?
You very rightly said, and this is burning problem now. We see that we hear so many people that they do not get, they are finding difficult to get the conception after the marriage. And after the 2, 3, 4 years, which is usual fashion now, that they want to wait for a year or two, and then they want to plan for a baby. Suddenly they come to know that the wife or the female is not getting pregnancy. They try to find out the medical solution of it. What is the real difficulty, why they are not able to find it? So they get investigated, and one of the reasons they find that it is a polycystic ovarian disease. And in this disease, one of the classical problems with the female is they don't generate the ovum. The ovary is not producing the ovum, which is very basic to start the pregnancy. When the ovum is not generated, there is no question of pregnancy going ahead with that. So by doing sonography, another test which they do, that the hormones imbalance, everything is done, and still after doing so many manipulations, they do not, by natural way. So the usual way to go ahead is the artificial insemination of husband. They put the sperm inside the uterus or inside the near the uterus, and then the pregnancy may happen. Then all manipulative method has to happen. The usual available. And what we offer in homeopathy, after going through medical record, I try to find out where the real problem is. If it is PCOD, as I said, we have been able to solve it. And if it is not, then we have to see the structural difficulties, like fallopian tubes, which are tubes which carry the ovum from the ovary into the uterus, at the middle of the cycle. So if that pathway is open or not, there is a medical test known as hysterosalpingography, or by through laparoscopy, gynecology has already proved that the tubes are open or blocked. In such cases, even if it is blocked, they try to find out any basic disease or not there. If there is no underlying structural problems, like blockage of tube, absence of, or the ovaries have gone into atresia or it's drying up. If they are not there, then there are chances that in such cases we do get the results. The ovum starts getting generated when you have solved the PCOD, a basic problem. And after that, we have to advise them what are the best days to have a relationship. So naturally, and then within few months, we have seen that with the help of homeopathy, in few cycles, as I would say, 3, 4, or 5, or 6 cycles, they go for the success for getting pregnancy.